Hi, my name is Sarah Sloan, and this is my final video portfolio. There are 6 student learning outcomes for Nursing 465, and in this, I will discuss each student learning outcome along with how I accomplished it. The first is implement nursing judgment to clinical situations using standards of nursing care, critical thinking, clinical reasoning, and evidence-based practice. I interpreted this as to what I've learned in class along with the research that I've done for the class and how it's been beneficial to develop a plan of care for the patient. I found an article on non-ventilated patients and the risk of developing hospital-acquired pneumonia after performing oral care. And oral care is something that I think is just kind of looked past, and the research really showed how important it is for patients to do oral care twice a day. So that was a great piece of research that I actually found for my nursing practice. The second is design and implement an individualized nursing plan of care for patients experiencing acute and complex healthcare alterations. What I realized in the hospital is that pain is a major complaint for patients, which makes sense. And I would verbally educate patients on ways to treat pain non-pharmacologically. I thought that this was really important when patients weren't able to take their pain medication just because of the time scenario, or if they were in just an incredible amount of pain. What are some ways that the pain could be relieved without taking the medication? So a lot of patients thought that using ice packs or heat packs was really beneficial. Yeah. The third is analyze the concepts of prioritization and delegation skills to the nursing process and care of patients with complex alterations in the clinical setting. So throughout this semester, we've learned which patients should be prioritized, which are the top of our list when we get there. And after receiving morning report, I started to think about which patient was the priority to check on based on their symptomology along with the pathophysiology of their diagnosis. After looking at a lot of the med-surg patients, it really did begin to get easier to see which one is the most acute or the one that I should really just go in and look at first. The fourth is apply an expanding range of knowledge to promote health and well-being to prevent complications in adult and geriatric populations experiencing illness and disease. For this one, I kind of interpret it as what is a concern with patients in the hospital. And one thing is that many patients are on opioids for the pain. And one of the adverse effects of opioids is constipation or just kind of being blocked up. And so I thought using the knowledge that I've learned through classes and through my clinical experience, I really need to look for the signs and symptoms of a patient developing constipation, and along with educating those patients of the adverse effect of constipation. So I thought that it was really beneficial also to educate on getting up and moving and physical activity and everything like that, because not only does that help with constipation, but it prevents a lot of other complications that could occur. The fifth student learning outcome is demonstrate professional nursing behaviors and values in all clinical interactions, situations, and setting. And this just kind of shows my professionalism in the hospital, and I was always on time. I was in uniform with my ID badge. I came with my stethoscope, with everything that I needed. I was well rested before going to the hospital, and I was just on my kind of A game while being with the patients. The sixth learning outcome is utilize nursing knowledge, information technologies, and evidence-based research to construct and implement safe, effective, patient-centered nursing care. And I really felt like this was in relation to IPAS. So when you do an assessment, it's important to know the pathophysiology behind the diagnosis and the importance of going and looking at the labs and diagnostics and imaging and the previous assessments that have been charted from the other nurses to see if there is a major change or to see if the patient's kind of spiraling downhill. And not only that, but using my knowledge of what the disease is and making sure that my assessment skills kind of match what I thought prior to going into the patient's room. Additionally, using research that I found also will help kind of guide my assessment skills. So yeah. The second part of this assignment is stating a summary of my growth and my goals for 2020. So first I'll talk about my growth. But instead of just talking about just this semester, I kind of want to briefly talk about the entire program. Prior to being in nursing school, I never had any experience in healthcare, so everything was really new to me. And when we went to rehab for our spring semester, I was so nervous to do everything. And, I followed the first day. We were able to be paired with another student, or we could just be paired with a nurse. And I really wanted to be paired with another student just to make me feel more comfortable throughout the day. And that was really helpful when first starting clinical. And then we were at rehab, and then COVID, and then we went back into the hospital. And it was kind of like starting over again. I had to kind of relearn assessments and relearn how to do assessments and just kind of relearn how to be back in the hospital. And then when I look at myself from the beginning of the semester to the end, I really see how I've grown. When I first started, I had heard about a lot of disease processes, but I hadn't seen them. And I think that I'm very visual, and that was really hard for me to really learn diseases. And then I found that everything a nurse states had to be true. They were educated, and every nurse was supposed to be the biggest advocate for the patient. And looking just at the last clinical day that I had, I realized how much I've grown. I had a patient who was pretty acute, and the nurse paid little to no attention to him, and I felt like I paid a lot of attention to him just because I felt like his condition was so critical. And then it also showed me that not every nurse is the biggest advocate for their patient. They're really there for, who knows, the paycheck or whatever it may be, or just work. But I really am able to look through the last semester and see that I'm able to do this, and that was something that I never really thought I would ever think, to be honest. I always thought that I wasn't good enough, or I didn't have prior experience, so how did I know that this is really what I want to do? But I have felt like over the last few months, I've really exceeded and grown, and I'm really hopeful that in the next semester I can expand my knowledge and growth even further. I wrote down 3 goals for fall 2020. The first is that I would really like to focus a lot on the pathophysiology for each disease, especially common diseases, so that I'm able to read a patient's disease process and have a good idea of what the assessment findings will be. Meaning, I want to look at the disease process and do an assessment and kind of have those assessment findings match the disease. But additionally, I want to know what interventions that I will have throughout the day. What nursing interventions am I going to be doing so that I can improve the patient's health? And I want to be able to know that quickly. The second goal I have is to have a better idea of what type of nurse I'd like to be. I'm hoping that in our next clinical placements, I'm able to, they'll kind of direct me as to what type of nurse I want to be in the future. I don't really feel like I found the unit I would like to work on when I'm a working nurse. I really enjoyed ortho, but I feel like that wasn't really the calling that all nurses say that they have. Lastly, I want to push myself out of my comfort zone. Sometimes I get stuck because I don't push myself, and this is the last semester of nursing school before I have patients of my own, so I'd really like to push myself to get as much nursing experience as possible before I'm doing everything on my own.